Hello and welcome to my anatomy lecture. I chose to do my research on femoral acetabular impingement. So I'm going to go ahead and read what I typed up. Femoral acetabular impingement, otherwise known as FAI, is a condition of the hip joint which causes pain in the front of the hip due to friction when the leg is moved into certain positions. The condition is caused by an incorrect curvature of either the femoral head, the acetabulum, or both, creating friction in the hip joint due to premature or improper collision or impact between the head and or neck of the femur and the acetabulum when the leg is moved into flexion, extension, and internal and external rotation. The pain it produces depends on the particular type of impingement that a person might have and how severe the impingement might be. The hip joint is a ball and socket joint where the head of the femur, the femoral head, acts as the ball and fits into the acetabulum, which acts as the socket. The joint is held in place and supported by several strong ligaments and the bone architecture. Around the edge of the acetabulum is also a ring of cartilage called the labrum, which provides additional stability to the joint. Both the ball and socket are also covered in a layer of smooth cartilage, which acts as an additional cushion to the joint and allows for smooth movement through normal ranges of motion. There are two types of hip impingements. A ridge or spur of extra bone on the femoral head is referred to as a cam impingement, whereas an irregularity in the acetabulum is called a pincer impingement. Many people are affected by a combination of both types of impingements. The result of either or both types is additional friction in the hip, which then causes pain as well as damage to the hip joint over time. Radiographs can be used to confirm a hip impingement, and in some cases an MRI or CT scan might be used to further assess the labrum, cartilage, and the natural shape of the bones to determine possible treatment options. Treatments can vary widely depending on each case and can be approached conservatively or with surgical treatment. Treatments can include anything from rest, activity modifications, anti-inflammatory medications, or physical therapy, to even steroid injections in the hip joint, and finally surgery. After all conservative non-surgical treatment methods have been exhausted, surgery may be recommended. In most cases, if surgery is required, the impingement can usually be treated with arthroscopic hip surgery, also known as a hip scope. This is a minimally invasive procedure where 2 to 3 small incisions are made and used to insert small surgical instruments into the hip joint to repair the damage. One of the instruments used is an arthroscope, which is a long, thin camera aided by the flow of saline so that the surgeon can see and assess the damage to the cartilage and labrum. A fluoroscope, which is a portable X-ray apparatus, is also used to ensure that the arthroscope and other surgical instruments are inserted into the joint properly. Other instruments used include shavers that allow the surgeon to remove any of the torn cartilage that might be creating friction in the hip joint, as well as shave away any of the bone bumps or spurs that might be causing the improper contact and in turn damage to the cartilage. If surgery is deemed necessary and performed, most people are able to resume normal daily activities after 6 weeks of physical therapy, but it could take anywhere from 3 to 6 months for one to experience no pain or soreness following physical activity. Some studies have shown that 85 to 90% of patients who end up having surgery are able to return to their normal physical activities and sports at the same level they were at prior to the onset of hip pain and impingement. And as with any surgical procedure, there are some complications that can be associated with surgical treatment in relation to traction. Traction is required to distract and open up the hip joint in order to insert the surgical instruments. This can sometimes result in post-surgery muscle and soft tissue pain in the thigh and hip area, as well as numbness in the groin area if there is prolonged use of traction. There are also neurovascular structures around the hip joint that can potentially be damaged during surgery. And lastly, there's always a chance of poor reaction to anesthesia and chance of infection. Additionally, there's also a high rate of conversion to total hip arthroplasty, which is a total hip replacement within 2 years of arthroscopic hip surgery. So based on my research and my own personal hip impingement journey, my opinion is that it's best to try to treat FAI with a conservative approach, as well as limiting certain movements and avoiding surgery. In my experience, trying to stretch, lengthen, or loosen the muscles surrounding the hip pain, mainly my adductors and psoas, only causes further pain for me. But if I do focus on keeping my core engaged and also avoiding certain movements that I know will cause me pain, I seem to be able to keep my symptoms at bay, or at least at a minimum. So I am going to demonstrate just a couple of exercises that I personally have found success with. They're more, like I said, not lengthening, loosening, or stretching exercises. They're more strengthening. And for me, I've had better results in that aspect. So the first one, and I don't really have a technical name for any of these, but this first one, you start in a tabletop position, firm down through your hands and engage your core, tuck your toes under, and then you're just gonna barely lift your knees up off the ground. And you're gonna just lean back, keeping your knees off the ground and taking your hips all the way back, and then just hinging back to tabletop. So hinging to the hips down and then back into tabletop. So that's one of the exercises. And then additionally, there are 2 exercises standing that I like to do and that seem to help give me some relief. And those are just the standing block, hip lift and drop. So you just raise up onto the block on one foot and you drop the hip down and then suck it back up into its socket and repeat. And I find that doing these few activities daily, I've seen a lot of improvement just in the last 2 weeks. So I'm gonna stick with it and hopefully see even more. And the last one is just the single leg balance. So lifting one leg up, going out into extension, and then swinging back into a warrior 3. And repeating. So those are just the few exercises that I really like. There are many, many, many resources out there that give a wide variety of different strengthening exercises you can try, as well as stretches and different release techniques that you can use to try to find relief that way. So anyway, I hope you enjoyed my lecture on FAI, and I appreciate your time. Thank you.